Hello, my name is Anna Hudson. I'm a registered dietitian at Winona Health. Good nutrition is important to everybody, no matter what their age or stage of life, but nutrition is especially important during cancer and throughout treatment. Today's video will focus on ways to manage symptoms and side effects of cancer treatment, including radiation and chemotherapy. If you're watching this video, you or a loved one might be suffering with some of the side effects of chemotherapy and radiation, which can include nausea, vomiting, diarrhea, constipation, taste changes, and mouth sores. Today's education will go through common, simple tips to help manage these types of side effects. Nausea is a very common side effect from both chemotherapy and radiation, and even other medications. You can help manage nausea by consuming different foods in your diet and also by changing the way you eat throughout the day. It is recommended to have 5 or 6 small meals throughout the day, and this is helpful in increasing appetite, but also to help reduce kind of that overwhelming feeling of looking at a full plate of food or trying to consume very large portions. In your small meals, try to include different food groups, include different colors of fruits and vegetables, and different sources of proteins. Choosing very bland and mild foods, such as saltine crackers, plain toast, or even white rice, are recommended. Foods that are not recommended would be things that are very greasy, high in fat, or very high in sugar, as these are heavier foods and can cause an upset stomach. Ginger has also been shown through research to help with managing nausea. You can eat ginger plain. It has a very strong flavor, so choosing a very tiny little bite can help. They also make ginger tablets. Please speak with your doctor before choosing to take ginger tablets. Ginger can also be found in many teas. Something that's very soothing could be a hot cup of lemon and ginger tea. Bowel changes are very common throughout cancer treatment. This can include constipation or diarrhea. If you're experiencing constipation, it's important to increase the amount of fiber that you're eating in your diet. Fiber can be found in many foods. We find it in our whole grains, such as whole grain cereals, whole wheat breads, whole grain pasta, and brown rice. We also have lots of fiber in our fruits and vegetables, so be sure to consume these foods as well. Whenever you're increasing the amount of fiber in your diet, be sure to also increase your fluid. Having enough fluid is also very important to help with digestion. Oftentimes, choosing hot beverages such as that tea and prune juice can help with digestion as well. Diarrhea can also be a common side effect of treatment. If you're experiencing diarrhea, it's important to do the opposite of what's recommended for those with constipation. For this, you want to decrease the amount of fiber that's in your diet. This would be choosing white or refined products, including white breads, white pasta, or white rice, as these are much gentler on your body and easier to digest. You also want to be careful with the fruits and the vegetables that you choose. Choosing canned vegetables or fruits will have less fiber than the fresh, raw types. Also, looking at vegetables and fruits that don't have seeds or skins. Melon is a common example of a fruit that is lower in fiber compared to something else that has more seeds to it. Beverages are also very important. You want to stay well hydrated while experiencing diarrhea to replace the fluid that you may be losing. It's important to increase your water intake, but also consume beverages that have electrolytes, such as broth or sports drinks. Avoid things that have caffeine in them, such as coffee, as this can be very irritating on the digestive system. One last tip is to consume foods with live and active cultures, such as this yogurt. This will help increase the good bacteria in your system and help reduce the diarrhea. To help manage mouth sores or a sore throat, choose foods that are very mild in flavor. Things that have a lot of salt or are heavily seasoned can be very aggravating to those mouth sores and can cause increased pain. Choose foods that are softer compared to dry, hard alternatives. For example, choosing a baked sweet potato with a nice soft texture would be a better choice than choosing something harder like a potato chip, which would also be very salty. It's important to choose foods and beverages that are at a neutral temperature, as very hot or very cold foods can also be aggravating to those mouth sores. Sauces and gravies can also help increase the moisture in foods. Also, sauces and gravies tend to have more calories, which can be important in increasing your calorie needs. Feel free to soften foods with these types of extra condiments and sauces. Taste changes can be very common. Oftentimes, many people experience a metallic taste in their mouth when eating foods. One simple way to reduce this taste is to choose a plastic utensil versus metal utensils. That's a great way to reduce that metallic taste in your mouth. If you're experiencing very dull taste or foods just don't have a very strong flavor, adding things such as citrus fruits like oranges, lemons, or adding things like pomegranate, things that are more tart to your diet can help increase that flavor. But keep in mind that these citrusy fruits have more acid to them, which would be aggravating if you had mouth sores. Another way to add flavor or to balance flavor in your diet is to add sugar to things that maybe taste a little bit too salty, or adding salt to foods that maybe taste a little bit too sweet. One main struggle is trying to continue to eat together with friends and family. If you're struggling with this and the taste changes, be sure to have the food prepared normally and then go back and add extra seasoning or extra spices to your own dishes so you can still enjoy eating with those that you love. If you are experiencing these or other symptoms, it's important to tell your doctor or nurse right away so that they can help you manage these symptoms. Keep in mind that these are very general tips, and if you have your own individual questions, please bring these up to your doctor as well. If you are interested in an appointment with a dietitian in the clinic, please ask your doctor or nurse for a referral, and it's also recommended that you check with your insurance carrier before scheduling this appointment, as coverage does vary. Thank you for watching today's video. I hope that you found some of these tips and tricks helpful.